Definitely in addition to, but I would prefer to talk to them in conjunction with each other. Honestly,
Okay. Okay.
it's
Yeah,
very,
it
very,
definitely doesn't have to
very,
be one or the other.
huh?
I said it definitely doesn't have to be one or the other. Um, it just sometimes people find it helpful to have a separate space.
Oh yeah, no, I'm one of those people who realize that I'm not the traditional what people think of as an artist. So the separation of the two has been an internal conflict for me
Okay.
because
That's,
I'm not a guy walking around learning to trying to get money being an artist. I'm an artist who was an artist before I understood any of this stuff, before I even knew money came into play. And I have
mm-hmm.
went and learned how to make money off of the art because it was going to be more productive for me to be making money off of the art than for me to be in other work environments. So
Yeah.
honestly, I mean, so I recognize that I'm not one of those people. I feel like I was talking to a counselor who was very attracted to the trauma, and it was separate from the artistic expression. And I recognize that my artistic expression represents the trauma, is why I know that I would be extremely comfortable talking to a counselor that's in an art therapy kind of a setting because they, in my perception of it and what I little bit I've seen, they are linking the work to the trauma as a form of therapy.
Mm-hmm.
Yeah. I
Yeah, there's
mean,
a lot of
so
cool work being done with trauma therapy, especially um, that they're thinking of kind of newer and more conventional ways to
yep.
help people process that, and it's definitely not the same old like here lay on the couch and tell me about your life kind of treatment.
Exactly. It's kind of like I love talking about my life, but I realize that I understand it a little better when I'm able to see it in front of me. And I've made enough of it to be able to, and I mean, I've made enough of it in the specific directions of what you and I are talking about.
Mm-hmm.
You know,
Okay.
like my images, the way I interact with being an artist, directly connect to the trauma that I'm sharing with you all the way across the board.
Okay. That's got to be exhausting on some level, though, like keeping the trauma at the forefront of your life at all times.
No, it makes it easier for me to get it out of me and put it to the side. And I recognize that I'm not hiding from it as much as I've put it somewhere.
Okay.
I
Um,
experience
is there?
exhaustion, but it
Oh,
has
good.
more to do with structural racism than it does making the artwork.
What do you mean about the structural racism?
Um, Pooh, is that a longer story than the first one? I'm just playing. I mean, it's
Are you talking about like also using art as a way to process through some of that as well?
no. What I'm saying is the exhausting thing that I experience in my life is trying to um, participate as an artist in institutions and the exhaustion that comes with the way the role that structural racism plays in me being able to engage in these places.
Oh, I see. Okay,
That's exhausting.
gotcha.
The work, it helps me go to sleep at night.
Okay. Sometimes, when people deal with heavy stuff like this, especially early childhood trauma, they often at some point in their life struggle with drugs or alcohol. Or maybe not even struggle, just experiment or use to cope. Have you ever like identified like that or found yourself using drugs or alcohol to kind of mask
You said
your
to kind of mask.
feeling or not feeling?
Oh no, I've never done drugs or alcohol to mask anything.
Okay. What about just drugs and alcohol use period then?
Oh yeah, definitely.
Okay. What kind of substances have you used?
And alcohol being a substance.
Yep.
Oh, alcohol.
Okay. Any marijuana, cocaine,
Mar-
LSD, anything like that?
marijuana.
Okay. Are either of those, like alcohol or marijuana, are those things that you use on a daily basis or on a regular basis?
Um, you said a daily basis or on a regular basis?
Or, or
Marijuana on a
regular basis?
marijuana on a semi-regular basis.
Okay.
Not every day. But I don't know. On average, 4 times a week. Um, yeah. Alcohol, eh, maybe once a week.
Okay.
Maybe less. Sometimes less. Sometimes more, and more never exceeding. You know, 2 days of alcohol, and when I say alcohol, I mean a beer, 2 beers in one sitting.
Okay.
You know what I'm saying?
Sure.
Yeah.
When you're using marijuana, are you smoking?
Yep.
Okay. And is it like the actual plant, or are you like vaping or doing dabs or anything like that?
The actual plant.
Okay. Okay. Now, some of these just basic questions that, we ask of everybody. Have you ever had any suicidal thoughts when going through any of these losses or just at any point in your life?
No, not at all.
Never? Okay. What about any thoughts of violence towards other people?
Thoughts of violence towards other people? No.
Hmm. Okay. Do you ever experience hallucinations? So, like seeing or hearing things that other people can't?
No.
Okay. And this one can be tricky because often it's very similar to when someone has like really high anxiety or even some trauma symptoms. But do you ever feel paranoid? Like you feel like maybe people are out to get you or people are watching you? Um,
No, not at all.
Anything like that?
No.
Okay. Okay. Um, so we talked about, adding in the art therapy and the counseling. I also wanted to gauge your interest just because we do have the ability to link you up with these things right away. Would be to see a psychiatrist, and that would be short term. I mean, everything that we do at Frontline is for kind of like an initial crisis period, or like, when someone is struggling with something and needs help right away, but doesn't have like their own providers or anything. The psychiatrist might be helpful just to see if we can get you some sleep, um, maybe address some of, sounds like there is some level of kind of ruminating thoughts about, your history and with the deaths recently. And I know some of that is good. You don't want to suppress that completely because it sounds like you are getting a lot of that out artistically. Um, but I think if you were able to get some sleep and get some rest, that might help things. And also maybe just deal with a little bit of the anxiety. I mean, is that something that you're open to?
Oh yeah. Can you give me a little more details about help me sleep? What does that mean? But I'm definitely open to it. Yes.
Sure, sure. Yeah, so I'm not a physician, like I'm not a medical professional. I'm just a licensed counselor, but they will prescribe different things ranging from, medications that are pretty mild, similar to Benadryl, up through, like the trazodone and the pills that are actually made for sleep. Um, Similar with anxiety, I mean, there's different options they can explore. Maybe even, you know, target some of the depression if that's becoming more intrusive than you'd like. I just think it might be a good idea to have a psychiatrist do an evaluation, not just to help you out with some of those little things, but just take a good overall look, and make sure that there's nothing that might be super helpful to you that, you're just not aware of.
No, no, that's cool with me. I do have where does marijuana fit in there at any place?
We don't
On
do
a
medical marijuana.
excuse me. What'd she say?
With our therapist,
We missed it. Can you repeat that?
We do not prescribe medical marijuana. If that's what you're asking.
Yep. Yeah. No. I was just curious.
Now, there's not necessarily like a rule out. Like just because you use marijuana, we're not gonna just like not treat you. But yeah, no, we wouldn't prescribe it. And after the initial, it's usually like 3 months or so. With our trauma therapist and with our psychiatrist, then they'll link you with providers in the community that are going to be most in line with what you're looking for and what's going to be easiest to maintain. So an ongoing art therapist, an ongoing counselor. If they feel like the meds are beneficial and you're like, hey, yeah, this is helping me out, then connecting you with a doc as well to keep going past that initial 3 month period.
Okay.